Helicopters provide a fast, versatile response to emergencies and can be the most effective way of getting highly trained clinicians to an incident. They can also be the fastest way to transfer a critically ill patient from our hospitals to a specialist treatment centre. This DVD will explain the use of the helicopter landing facilities at Maidstone and Tunbridge Wells hospitals. It will explain the rules and demonstrate the process of carrying out the helicopter landing and takeoff. It is important that you are aware of the safety procedures that must be followed when on or around the landing sites. At both Maidstone and Tunbridge Wells hospitals, purpose-built 24/7 helipads are available. At Tunbridge Wells, it is located in front of the emergency department, and at Maidstone to the rear of oncology. The hospitals are mostly served by the Kent, Surrey and Sussex Air Ambulance Trust, who fly 24 hours a day to incidents across our area, providing expert pre-hospital care at the scenes of serious incidents. The Trust is also served by search and rescue aircraft from HM Coast Guard based in Kent, who have winching capabilities and capacity to transport multiple casualties. Occasionally, you may see other aircraft, such as helicopters, from the Police and Children's Air Ambulance Service. Irrespective of the size or type of aircraft, the main priority is the safety of patients, visitors and staff. The aircraft provider will notify the appropriate emergency department of an inbound helicopter, irrespective of whether it is carrying a patient. The emergency department must immediately report the incoming aircraft to the switchboard on 3333, clearly stating which site they are calling from.
Inbound to Tunbridge Wells Hospital, accident and emergency.
Switchboard will then alert the helicopter team via the bleep system, including porters, security, estates and clinical site managers. A rapid check of the landing site will be necessary before the aircraft lands to ensure it is free from obstructions, foreign object debris such as litter, and to ensure no one is standing in the landing zone. Special care needs to be taken with pushchairs, pets and small children. Security will also secure perimeter roads and footpaths at Maidstone using the gates provided. At Tunbridge Wells, care must be taken that no one is standing on the zigzag footpath. It is important that no large pieces of debris, such as temporary road signs, rubbish or building materials, are able to be blown around. During activation of the helipad, it is essential that no unauthorised persons have access around the helipad. Remember, you will not necessarily know what sort of helicopter is coming in or from what direction, so you must follow the instructions given by security and the clinical site managers. If a patient is coming in, then a trolley from the emergency department should be prepared. This trolley should have no equipment or linen on it, and those preparing to receive the patient should wear gloves. The trolley must not be taken onto the landing site until the aircraft has landed. Once the aircraft is landed, the team should wait until the rotors have been turned off and the engines have been shut down before approaching the landing area. If the aircraft crew are not available, then thumbs up signal from the pilot must be obtained prior to approaching the aircraft. It is important that the aircrew take the lead in removing the patient from the aircraft, as they are trained to use the equipment. Clinical handover should take place in the emergency department and not on the landing site. Everyone involved in helicopter reception must wear high visibility clothing. Those outside during landing and takeoff should consider wearing eye and ear protection. For larger aircraft landings, such as the Coast Guard, eye and ear protection is mandatory. A cabinet containing personal protective clothing is located in the emergency department entrance lobby at Tunbridge Wells and at Maidstone in the lobby leading to the helipad. If staff are required to go onto the landing site with rotors running, then full PPE should be worn as per hospital policy. All precautions taken during landing must also be followed during takeoff. Remember, the helicopter may take off in a different direction than it landed. It is essential that the helipad lights are switched on as soon as the landing site has been checked, day or night. They must then remain on until the aircraft has taken off. It is important that the lights are not switched off until the aircraft has departed and can no longer be heard. This will allow the pilot to return in the event of difficulties. It is important that no flash photography, laser pens or torches are shone at the aircraft, as this can distract the pilot. In bad weather, you should take extra care as paths may become slippery. In the event of a fire or accident on the landing site, staff should withdraw and call for the emergency services via 999. Where clinicians are considering transfer out by air, they should discuss this with the clinical site managers, who will manage the arrangements for landing and transfer team welfare. Initially transferring clinicians should discuss the case with the HEMS support desk at ambulance control. Where HEMS are unable to transfer, the clinical site managers have contact details of other providers, such as HM Coast Guard. The ability to transfer by air depends on numerous factors, not only the weather conditions en route, but fuel and landing facilities at the destination, along with patient's condition. All air transfers must be authorised by a consultant. Never stand in front of the aircraft approach. This may lead to an aborted landing. Never approach the aircraft from the rear. Never approach the aircraft with rotors on unless you are wearing full PPE, including helmets, eye and ear protection, and you have a clear thumbs-up signal from the pilot, or are escorted by the aircrew. If the doors are not open, even with rotors off, you must await a thumbs up from the aircrew before entering the landing area. High visibility clothing must be worn at all times. When large helicopters are inbound, eye and ear protection is mandatory.